Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Well, today is January 25. Yesterday, we had the first Health and Human Services Committee of this session, and it was pretty good. It was long, it was a bit of a mixed bag with lots of different bills, but one of the best things that happened in that committee was the passage of HB 2111. This is a bill from Representative Walt Blackman from rural Arizona. I am so appreciative of him proposing this bill, which funds the Healthy Families Program. This has been one of my signature issues for a very long time. I have also proposed this bill in other years and also in this year. And I am so excited that it actually got out of committee. I'm also excited that it is in Governor Ducey's budget. It's like, yeah. The Healthy Families Program will help women after childbirth. It helps them be better moms. It's a system of voluntary home visits, and they teach the moms. They also look for hints of things that might be going wrong with the moms or the babies, particularly adverse childhood experiences. And this is a really good thing. We need to help moms and babies be successful. There are lots of other opportunities this year too, which is also very exciting to me. The state has gobs of money. We don't want them to give it all away in tax breaks this year, right? There are needs in our state. And so there's other opportunities in the area of maternal and child health. For example, there is the Senator Pace bill. It is SB 1272. This is a bill that extends postpartum care to 1 year. Part of the reason that moms are dying after childbirth is that the window of care for access patients is very short after childbirth. Sometimes they can't even get in to see the doctor for a checkup in that short window. Extending that care to a year will prevent death, as far as I'm concerned. What we found when Arizona published the Morbidity and Mortality report for moms, we found that 80% of those deaths were preventable and 20% were suicide. So moms need help, especially with the COVID pandemic. There's a lot of stress on families and a lot of stress on single mothers and their children. There's other parts to this mix. When I studied the maternal and child health data a few years ago, I saw a lack of access to care for prenatal care. Now this is dumb. Prenatal care will help us have more healthy babies in the state of Arizona. So we should increase access to prenatal care. This is where the nurse-family partnership comes in. Now this is similar to Healthy Families, but these are nurses. These are not health educators or community health workers. These would be nurses. And they connect with moms before the third trimester. So connecting with moms before the third trimester helps moms with their prenatal care. This will help babies come to term before they're born. This will also help young mothers. And so nurse-family partnership is for new moms and moms who are at risk. They need funding across the state also. Now that is still in limbo right now. So I'd like to give a shout out to these three programs, but also really what the state of Arizona needs is a systems approach to maternal and child health and adverse childhood experiences, because these things go together. When the moms are in crisis, the children can fall into adverse childhood experiences, and those would be food insecurity, housing insecurity, the loss of a parent due to drug addiction, death, or incarceration, and many other bad experiences for little children. We want our children to grow up healthy. So let's properly fund maternal and child health, and let's really attack adverse childhood experiences. We have the money to do it. We really don't have any more excuses to just sit on our thumbs.